patient nods during instructions, but later takes the wrong medication dose. What went wrong? A. The instructions were too complicated. B. The patient wasn't listening. C. The clinician never checked for understanding. Keep your answer in mind. We'll reveal the answer shortly. In this video, you'll learn what teachback is, why it matters, and how to use it in a way that feels respectful instead of like a test. Teachback is a communication tool used in health literacy and patient education. The big idea is simple. First, explain clearly. Next, ask the person to explain the information back in their own words. Then, clarify anything that was unclear. This brings us back to our opening quiz. The correct answer is C. The clinician never checked for understanding. Teachback fixes this by shifting the focus. It is not a test of the patient's memory. It is a way to check understanding by checking how clearly the clinician communicated. That shift matters. Instead of asking, "Do you understand?" Teachback asks, "How well did I explain this?" It keeps the responsibility for clear communication where it belongs. Let's work one example. A clinician explains, "Take 1 tablet in the morning and 1 tablet with dinner." Then they might say, "We talked through a few steps. Just so I know I explained it clearly, how will you take this medicine tomorrow?" If the patient says 1 in the morning and 1 with dinner, the clinician has good evidence that the message was clear. If the patient says something different, that is useful information, not a failure. A common mistake is asking, "Do you understand?" Many people may say yes, even when they are unsure. Teachback works better because it asks the person to explain or demonstrate the next step. So far, we have covered the purpose of teachback and the most important mindset. It checks the explanation, not the person. Want to remember this technique long term? Tap the link for Quizlet study tools. Then jump back into the video. Lock in what you learned and keep going. Now, let's deepen the idea. Teachback is not only for spoken instructions. It also works when someone needs to show a skill, like using an inhaler, checking blood sugar, or caring for a wound. When the task is a skill, teachback becomes show me. The clinician might say, "I want to make sure I showed this clearly. Can you show me how you will use this inhaler when you are at home?" Suppose the patient misses one step. That does not mean they were careless. It means the explanation or demonstration may need another pass. The clinician can calmly reteach the missed step and ask again. Teachback can also reveal what the patient thinks is most important. For a broader check, the clinician might ask, "What will you tell someone helping you at home about today's plan?" This kind of question shows both understanding and priorities. Maybe the patient remembers the medicine but forgets the follow-up visit. That gives the clinician a chance to make the plan clearer before the visit ends. The edge case to avoid is making teachback feel like a quiz. Tone matters. Phrases like, "So I know I was clear," or "so I can check how well I explained it," make the process feel safer. Here is the basic pattern. Explain the information in plain language. Ask the person to explain or show the next step. Listen for gaps. Then clarify and check again if needed. When teachback is done well, it becomes a teamwork tool. The patient leaves with a clearer plan, and the clinician gets a better sense of what still needs support. To recap, teachback checks whether the clinician explained clearly. It asks patients to explain or show the plan in their own words. It works best with plain language and respectful phrasing. If something is missing, the clinician clarifies and checks again. If you want to practice what you learned today, check the links in the description for Quizlet's memorization guide and study tools designed to help you remember it longer. Keep learning, keep practicing, and we'll see you in the next video.